Welcome back to Ask Dr. Rick on 590 The Fan, KFNS. If you have a question for Dr. Rick, please head to facebook.com/Ask Dr. Rick Lehman. Also, you can follow him on Twitter. Ask Dr. Rick now. Back to the show, presented by Bellman Buick GMC.
Ask Dr. Rick, our final segment here on 590 The Fan, KFNS. I'm Dan McLaughlin of Fox Sports Midwest. And again, this is presented by Bellman Buick GMC. If you missed the show yesterday, we began a brand new baseball show between noon and 2, Baseball Fridays, and one of my guests was Adam Wainwright, and we talked over the Tommy John situation, and now coming back from that injury. I'm going to have Dr. Rick talk about that in just a moment, but again, head out to Bellman Buick GMC, I-270 McDonald Boulevard, guaranteed credit approval. They're taking $12,000 off their 2012s, and you walk in there, and they have one of the largest showrooms in the Midwest. That's Bellman Buick GMC. So, Rick, let's bring you back in the conversation. Adam Wainwright, what can we reasonably expect out of Adam next year?
First of all, I think the Tommy John surgery is a great surgery, and it's a surgery that's evolved over the years. Dr. Jobe did the first one in the 70s. And the operation he did is nowhere close to what we're doing today with special techniques, arthroscopic surgery, etc., because there really was no arthroscopic surgery then. The operation that I now do is a fairly straightforward Tommy John reconstruction. I've probably done about 400, 500, something like that. Pretty common operation. And I've done it at all levels. We used to do it just on elite pitchers. We're seeing kids younger and younger with this problem. So we're seeing kids 13, 14, they tear their ulnar collateral ligament. They want to play baseball, and they end up getting reconstructed. The first year after a Tommy John surgery, and I think when you watch the progression, it used to be it took 2 years. Now it probably takes about 9 months. So I really expect a pretty good result the first year after a Tommy John surgery. So if you look at Strasburg and Wainwright and these guys, they do very, very well. But clearly, to hit their peak after the reconstruction, it's a 2-year process. So he's going to have a much better year. It's going to be much more representative of where he is, and he's probably going to have much less fatigue, pitch more innings, and be much more effective, especially with changeup, curveball, etc. So I expect pretty much a normal year from Adam Wainwright this year.
And you bring up curveball in particular, which he's got a great 12-6. And do you say that because of the torque that's on the elbow with that type of movement?
You know, when you come back from Tommy John, you start with some short toss, you go to long toss, and you bring it in, and you then throw off the mound, and there's a real progression. But you really don't start with curveballs, any of the other pitches for a while, number one. And number two, even though there are studies that show there isn't a whole lot more torque on the elbow, when you talk to professional pitchers, Major League Baseball players, guys playing minor league ball at every level, they'll tell you it's much harder after a TJ to throw a curveball, to throw a slider. So I believe that it probably does take the second season until they're totally comfortable throwing the changeup, throwing that slider, throwing that curveball, and I believe they do feel a little bit when they throw a lot of curveballs. So most of those kids will tell you, you know what, the first year I could throw it, but I really couldn't break it off. I really didn't feel comfortable. Maybe it was a little bit sore. But now I'm really having no problems at all. I can throw as many curveballs as I want. So the second year is really when you see a little bit better ball position on the plate and you see much better breaking ball.
Dr. Rick Lehman is with us. His show on Saturdays, Ask Dr. Rick, brought to you by Bellman Buick GMC, as well as Baseball Fridays here on 590 The Fan, KFNS. I'm Dan McLaughlin. And Dr. Rick, you brought up really probably the most prominent story in baseball, which was Steven Strasburg a year ago. They say that, hey, the reins are off this year. We're going to cut him loose. Did you agree with curtailing his innings a year ago that would have a long-term effect, a positive effect for Steven Strasburg in his career?
You know, in all these years, I have seen patients, players, athletes managed, and I don't know that I've ever seen better management of a pitcher, a young pitcher, than Steven Strasburg last year. So, yeah, I agreed. If there was any criticism, and I really have none, it would be that maybe they should have held out 30, 40 innings for the postseason. And that's just as a fan. That's really not as a doctor. But in terms of managing the 10-year process of a pitcher as opposed to the 1-year process or the 2-year process. And, you know, if you look at Major League Baseball, there's a lot of re-tears of Tommy John after the surgery. So Athlete has it, reconstruction, does very well, and then all of a sudden 3-4 years later, 5 years later, you see they've retorn the reconstruction. And that happens not infrequently. And part of the problem is with every pitch, you're maximally stressing that ligament. So if you're throwing the ball 80 or greater, which in the bigs are going to throw it 80 or greater, every single pitch, that ligament is getting maximally stretched. It could tear on any one pitch. And if you think about that, then you got to look at managing that athlete for 10 years or 12 years, 9 years, whatever, instead of 1 year or 2 years. And I think that what they did was huge. They did a great job. They're looking at the long term of this kid, and you're going to see his career is going to be substantially better for much longer based on his management last year. And, I applaud them.
We have had such an advancement in the elbow and Tommy John surgery. Why, and this is just from a general perspective of the average fan out there, why is that so advanced? And yet, if a pitcher comes up with a shoulder injury, that seems to be, the ultimate cause for concern to where a guy will never get back to where he was and maybe will never play Major League Baseball again at that level.
Well, I'm going to turn it around on you. That's a great point. And, we do very well with the elbow. So reconstructions of the elbow, which used to be fraught with telling an athlete, hey, they got a 50-50 shot of coming back. You see a kid with a rotator cuff tear, and you always think you're going to do a good job. You do a good job, you fix it, you fix thousands, or I fix thousands, and for some reason they just never seem to really get back to where they were. So if you got a rotator cuff tear or a bad labral tear, it's a whole different ball game, and that's 100% right. In the Tommy John surgery, when it started out, and you really, Dr. Job, Los Angeles Dodgers, you got to applaud the guy. I mean, the guy, no one ever did it before. It's like Columbus or something, and this guy's in there reconstructing the ligaments in the elbow, kind of having no idea what's going on, and he pretty much nailed it. But with the advent of arthroscopy, meaning you can look in the joint, you can see if the joint's gapping open, and with the advent of research, guys spending hours and hours and hours with cadavers and ligament tension and where the ligament goes and trying different ligaments and different fixation, the surgery has really been perfected. So we know exactly where the ligament goes. We know exactly how to tension the ligament. We know that if we use this size ligament, maybe a hamstring instead of the palmaris, it's a little thicker, it might be a little stronger, etc. So there's been huge advances. The shoulder is so complicated that even though you can fix it and you can put Humpty Dumpty back together, you can't make Humpty Dumpty throw the ball so good after putting it back together. And those athletes really don't come back. And if they do come back, they come back at a reduced level.
Dr. Rick is with us. A few more questions before we let him go. If you're the Cardinals, and Yadier Molina has been a league leader in innings caught behind the plate, which is such a demanding position, he's now getting up there in age a little bit, but you've locked him up long term. How concerned do you get about knees and the continual punishment that he gets behind the plate? And my question, I guess, Doc, would be this. Number one, how concerned do you get? Number two, is that something where, from your advice in dealing with baseball teams, do you tell them, hey, at this age, you need to curtail certain guys to make sure that injury is not part of what we're talking about, year 2, 3, 4, or 5 of a contract?
Well, first of all, I think that the catching is brutal. I don't care if you're a softball catcher, if you're playing women's softball, men's softball. It doesn't really matter. You're up and down, and I can't tell you how many patients I've seen in all these years where they come in, they squat down, you hear this horrendous grinding, you think someone's breaking up some eggs in their knees, and they tell you every time they squat down when they're catching, they hear this grinding. So it doesn't matter if you're in the bigs or where you are. When you're up and down, you're a catcher, it's a lot of stress on your knees and specifically your kneecaps. Pain walking upstairs, difficulties squatting, can't kneel on your knees, etc. So here's a guy that's been doing this a long time, probably the best catcher, forever, and now he's getting a little bit older. He's clearly going to have a little bit of arthritis underneath his kneecaps. Every catcher does. And you're trying to look at, A, preserving his career lengthwise, and you want the best he can give you at the plate, behind the plate, etc. So, in my opinion, off season is huge. And I think Roger Clemens, love him or hate him, really showed us that the off season is really make it or break it for these athletes. Number two, you do have to start looking at innings caught and trying to insert some rest days, some recovery phase, some downtime, whatever you want to call it, because he isn't going to be able to perform and throw and catch and perform at the level game after game after game like he could when he first started out, when he was a rookie, year 2, year 3. And the last thing is, during the season, you may want to do some things that are going to help lubricate his knees. So these hyaluronic acid injections, we do that a lot in athletes prophylactically. We know they're going to have a problem. Maybe they had an old knee injury. I got NFL guys, we see them on Mondays after their Sunday games. They're not really having a big problem, but we know if we do some of these prophylactic things, platelet-rich plasma injections, hyaluronic acid injections, it really helps them long term, kind of a Steven Strasburg sort of deal. And so I think you start inserting these things, and again, you're not looking at tomorrow or you're not looking at next week, you're looking at, the end of the season, the playoffs next year, 2 years from now, and all those things pay off. It's sort of like changing your oil. You don't really know why you change your oil. A guy says you change your oil, but you just do it every 3,000 miles, and that's good for your car. Well, it's the same thing. If you prophylactically get after it and start treating him like he's got a little bit of damage in his knee, and you're looking at the long term, he's going to perform much better, and he's going to perform much longer.
It's Dr. Rick Lehman. You can hear him on Saturdays, every Saturday, noon to 1. Ask Dr. Rick. You can follow him on Facebook, facebook.com, Ask Dr. Rick Lehman, and also on Twitter. Doctor, as always, we appreciate it. Thank you.
Thank you.
To give you an idea of Dr. Rick Lehman and his resume, I'm going to throw some names to you very quickly just to give you an idea of just how good he is. It's names like Tony Twist, the former tough guy in St. Louis Blue. Jackie Joyner-Kersee, one of the greatest female athletes ever. Dr. Lehman has worked with her. Craig Virgin, he is one of the top USA runners in Olympic history. Nelly from the entertainment side of things. So that's just a few names to give you an idea of just how good and well-versed Dr. Rick Lehman is. And if you'd like to follow him on Facebook, we would advise you to do that. That's the best way to get your question in. And again, it doesn't have to be a sports-related issue. This is a situation where if it's just something where you have back pain or a neck pain, dealing with an elbow, a wrist, finger, hand, knee, foot, whatever the case may be, anything, just go to his Facebook page, and many times he will answer your questions directly, but we'll also try to get those on the air. Facebook.com/Ask Dr. Rick Lehman. Facebook.com/Ask Dr. Rick Lehman, and he's also on Twitter and has a website as well. So it's Ask Dr. Rick, and you can hear this program. Again, that is every Saturday between noon and 1. On Fridays, it's Baseball Fridays here on 590 The Fan, KFNS. I'm Dan McLaughlin of Fox Sports Midwest, and I'm proud to be bringing you these shows. And again, they're brought to you by Bellman Buick GMC, and Baseball Fridays is from noon to 2 every Friday here on 590 The Fan, KFNS. Again, this has been brought to you by Bellman Buick GMC. They are located off I-270 and McDonald Boulevard. They right now are offering employee pricing. And if you're listening to the radio right now and you head in and say, hey, I want a car, whether it's new or used, with employee pricing on the spot, they will do that. So what that means is that you pay what the employees would pay for a car. They also have 2012s that are available to you, and you can get, once you walk through the doors, $12,000 off at Bellman. Also, if you have bad credit, don't worry about it. You have guaranteed credit approval at Bellman Buick GMC. So that's just some of the reasons as to why you need to go find the top dealer in town. Bellman Buick GMC, I-270 and McDonald Boulevard. Also check out their selection at Bellman.com. I'm Dan McLaughlin of Fox Sports Midwest. As always, thanks for being with us. For Dr. Rick, I'm Dan, and we'll talk to you next week on 590 The Fan, KFNS.